Welcome back. Endometriosis is a condition that affects women of childbearing age. It can start as at a person's first menstrual period and last until menopause. Now, factors that make someone more likely to get endometriosis are those such as never having given birth, menstrual cycles occurring more frequently than every 28 days, also having higher levels of estrogen in your body, and these are just to name a few. Mphonyana Verbeeck is a young woman who suffers from this condition and joins us today alongside Dr. Sylvi Kapundja to tell us more. Ladies, good evening and welcome, and thank you so much for being here.
Good evening.
Good evening, and thank you for having us.
Talk to us about how and when you found out that you had endometriosis.
I actually started having symptoms the first time I had my period. I started my period like any other girl, 13 years. The first 3 months, I bled like 7 days every month, and then from then, it wouldn't stop. I would go to the clinic, I would talk to people, but the shame that is brought to people who are bleeding like that, especially young girls, it led me to end up keeping quiet because the accusations and so forth. So it went on and on up until I got diagnosed formally in 2017. That's when I formally got diagnosed.
And how many years later was that?
Ooh, 2017, almost 20 years. So by the time I got diagnosed, it had spread severely, the point of no return. I now have stage 4 endometriosis. And there's nothing that can be done for me. Literally, I've lost my uterus, I've lost one ovary, and I'm just left with one ovary. And so I just have to bring this to the attention of the parents, mothers, men who have daughters, and men who have wives that are going through some of the symptoms that I will explain later. Just listen. Even the doctors and nurses, they should just listen. Instead of trying to come up with solution or trying to give quick fix. Listen. I cannot come back to the doctor every 6 months, every month, literally.
With the same issue,
bleeding heavily, pain, and you just give me Panado or you give me Tramadol, or listen and find other ways on how you can help me.
Yeah. Dr. Kapundja, explain this medical condition to us, and then what causes it?
Okay, so in a nutshell, and in the simplest terms I can explain endometriosis, it's a condition in which your endometrial lining, so the menstrual lining in your uterus, implants somewhere else outside the uterine cavity. So these cells go to places like your ovaries, it can go as far as your liver, wherever basically in the body, and that's how we classify it in stages. And then when you're on your period, you experience severe period pains because these cells, since they are manufactured, or the way they are created is to shed off during your menstruation. When your hormones are at a level where you're supposed to be on your period, they also shed off wherever they are, and then this causes severe period pains. So it doesn't really have specific causes. The causes listed out there are quite contradictory. We don't even really understand the pathophysiology ourselves as doctors, but there are certain theories that yes, it spreads through the blood. It can also be genetic, and risk factors such as starting a period early and so forth can be risk factors, but not identified as like a cause.
Right. As Mpo mentioned, she's got stage 4 endometriosis. Yes. What are these different stages, doctor?
So they can usually be classified into 3 or 4 stages. I'm very sad to hear Mpo's story because that is basically the final stage where we remove the person's uterus. So stage 1 is usually when the endometrioma, so the cells that leave your menstrual lining in your uterus and they implant somewhere, we call them endometrioma.
Right.
So stage 1 is when the endometrioma is confined around the uterine areas, like the ovaries, the fallopian tubes, around the female reproductive system. And then stage 2 is around the pelvic organs, like let's say your bladder and things like that, but it's not outside at other systems yet. And then stage 3 and 4 depends how far it has gone outside the body, but it's outside the peritoneal cavity, your perineal cavity. So it's outside that lower area. It's now up there. It can be your lungs, basically anywhere. And endometrioma can develop anywhere because it can spread. It can spread through your lymphatic system or your blood system. So it can basically implant itself anyway.
Let's talk about the medical procedures that would be applied to treat endometriosis, doctor.
So it depends on the staging.
Yeah.
But as a first timer coming to the hospital and your patient and your doctor suspects endometriosis, they're first supposed to treat you for your symptoms. So symptomatic treatment and management is usually our first go ahead. So this involves what we call non-steroidal NSAIDs, inflammatory drugs like Brufen and the others. And then it also involves hormonal treatment, which involves our combined oral contraceptives, to name a few.
Yeah.
So those ones help basically by mimicking pregnancy. So it shortens your menstrual period. It also shortens the symptoms, and it also shortens the amount of blood you shed.
Right.
Yeah.
But talk to us about the symptoms that you experienced over the years and the treatment that you had to undergo.
Okay. The first, as I mentioned earlier, the first symptom I had was heavy bleeding. So when I first sought help, I was told, like, no, I'm just sexually active. It's normal for teenagers, and I was put on Depo-Provera. It didn't stop. And then about a year later, I was put on oral contraceptives, like she mentioned, overall. And it didn't help. And having painful periods, like I was skinny, I was in pain, I was cramping, you're tired, you're depressed. Like, I can't tell you how many times I have tried to end it, because you talk, you cry, and apparently it's physically impossible to be in that amount of pain when you explain how much pain you're in. So it's tiring. So I've heard that, and then I've been given funny diagnoses. I had PCOS, I had what do you call it, double uterus syndrome. Your uterus is growing, it's swollen, you have a cyst almost the size of a tennis ball. I've heard, you name it, I've heard it. But the real issue that had to be addressed was never addressed up until I just couldn't take it anymore.
And since having officially being diagnosed, how are you managing it now?
Since I have stage 4 now, I go through surgery every 6 to 8 months just to excise it, to just remove it and to numb the pain. The latest surgery I had was mid-June. That's the latest one I had.
Yeah.
So I go through that, and due to that, I also cannot have. I used to be a teacher. I am a qualified teacher, but I had to resign from my work because you spend you get operated every 6 months, and then you have to spend 6 weeks recovering. That's literally 3 months out of my life in bed in a year, and then to have a full-time job, it was impossible.
Yeah.
So that's why I decided to literally start this and tell ladies, young girls, like, you are not crazy, you are in pain, seek help. This is real. I can't bear kids anymore. I can't, and it's not a joke.
Of course, now you're so passionate about teaching and educating young women alike about the issue. And as you mentioned, at stage 4 endometriosis has affected your reproductivity and your fertility. You can't have children. And I'm sure the emotional, mental journey must have been just as strenuous as the physical one. What have you done for yourself to help yourself recover from this, not only physically but emotionally and mentally?
I do go to therapy because I go for therapy when I can't handle it anymore. The worst thing that I actually experienced through this whole dilemma of endometriosis was in 2019 when I did end up having to resign. But that was the least, because that year, within a period of 4 months, I lost my uterus, I lost my job, I lost my, not identity, but what do you call it? Self-confidence.
Right.
But the worst that I felt was when I was told I was crazy. That by a doctor, there's no way you can be physically in that amount of pain. She mentioned a few pills that you get for pain. I was on Tramadol, 2 pills a day. She knows the dose. I was on naproxen 3 times a day. I was on Tegan at 10 milligrams 3 times a day. All of them at the same time. I was still in pain. I could not walk. I could not stand. I would be standing in front of the learners and chairs would be just rolling down. That's the amount of pain I was in. And I was told that it's in your head. It's phantom pain. Do you know what phantom pain is? That's what I'm being told. The psychiatrist that is close to Mediclinic, he had to be called in my ward just to come and confirm the theory that the doctor had that I'm crazy. I'm not in pain. It's not real. So that was the worst. The lowest point. That was the worst that I have been made to feel due to what I have been going through. And I'm at the point now where I have nothing else to lose. I lost my mind. I lost other things. There's nothing literally that I have to lose. But to help people learn about this thing and then do not dismiss it. You cannot be bleeding 5-7 days and not.
Dr. Kapundja, what should women be aware of, and at what point should they, seek medical help?
Okay, so we like to classify or let young women know that when they experience the 4 Ds that I'm going to mention, it's an easy acronym to remember, 4 Ds. So it's medical terms, but I'll explain. So the first D is dysmenorrhea, which is painful periods. The second D is dyspareunia, which is painful sexual intercourse. And then the third D is dyskinesia. So this is painful defecation when you're going to the bathroom. And then the other one is dysuria. So when you're peeing, and then you also have pain. So any of those things, when you have pain involving anything down there, and it's extreme pain, as with Paul's story, you should always seek medical help. You should definitely seek medical help, and don't ignore it. Don't ignore it, because it does cause it can cost you your fertility as well.
Well, just very lastly and very briefly, I know that you will be on Good Morning Namibia tomorrow morning as well to bring more awareness to this very important topic. But to some women watching this evening who's going through the same thing and, is realizing I'm not alone, what words of upliftment or encouragement do you have for this woman?
You're not alone. You are sick. Don't dismiss what you're feeling. Listen to your body. And speak up for your body.
Listen to your body. That's a very important one. Dr. Kapundja and Mpho, thank you so much for being here this evening. It was lovely speaking to you.
Thank you so much, Nina.
Well, that was our health segment for this evening. To end of the start of our week's program, we'll leave you with some sweet sounds from Namibian songstress Blossom. From all of us here at the Daily Roundup, thank you for watching and good night.